there was one time I was there, and I guess someone had, I don't know if it was a pocket knife or what kind of knife it was, but they snuck it and they put it in like how do I say, the paper towel holder in the bathroom.
Whoa.
A breath with Brefo.
What's going on, everybody? Back with another podcast. We got Laura with us today. It's been a while that we've been talking about this, and I'm glad we are finally able to do it. How are you?
I'm doing well. How about you?
I'm good. How are you feeling?
I feel good.
How was your day?
It was good. Busy, but it was good.
Right. So you are in the medical field, and it's gonna get deep because I really want to get into that because, correct me if I'm wrong, but I feel like also like like mental institutions kind of have a correlation with each other. Do you agree? Or?
No, I agree. Yeah, they do.
Okay, so you did work in a mental institution.
I worked in a hospital that had inpatient psych in it, and it was a locked unit, but yes. So yes.
Okay. So we're going to get into that. That's going to be crazy. 'Cause I know you have some crazy stories. But before that, you went to South Korea recently.
I did.
How was that?
It was really cool. It was genuinely a culture shock, but it was a lot of fun. I went to visit my friends. Shout out to them, Astrid, Jesse, and Amber.
Shout out.
So I went to see them because they're teachers out there.
Okay.
So they had some things planned for us, and there were things that we wanted to do. So we went with a pretty small group, but it was good. And we did a lot of walking, and we just discovered a lot of places, a lot of food. So it was genuinely a lot of fun.
So you said it was a culture shock. So
it was.
What is a big difference that you saw between living in the States and then going to South Korea?
So the technology, definitely. It was very much more up to date.
Oh, wow, yeah.
A lot cleaner than New York, obviously. So there were some places where I did feel like, okay, this is more New York to me, but I didn't feel unsafe to go to the bathroom because guaranteed the bathroom's gonna be spotless. And then the subways were a lot more easier to understand than they were for me to understand it here in New Jersey, New York.
Even if it was were they translated or
they were some of them were translated. So but on the trains they would say your stop in Korean, and then they would also say it in English.
Oh wow. That's cool.
But we did have to download a whole different other apps. One of them was literally Google Maps, but a Korean version.
Oh wow.
And then a translating app just in case. We learned how to say hi, bye, thank you, just to be more polite and proper and respectful. And yeah, there were a couple. We downloaded a taxi app, it was an Uber out there, so we were able to use that.
So did they not have Uber or
They didn't have the Uber app. It was just their own. So it was called Kakao Taxi. So you had to download it, and it was basically, when you look at it, it's literally Uber.
Right.
It looked exactly like Uber, just a Korean version of it.
I feel like we as America failed so much that they want no parts of anything.
No, I agree. I completely agree. It's true because out there, I guess there was a thing with elders, we did get some looks.
Oh,
so
right.
because we're not from there, I got looks because of my tattoos, my friends did.
But I know this is different from the Japanese culture, but people in South Korea, they have tattoos.
They do.
They especially now with what's that group? It's a popular
BTS.
Yeah, they're are they Korean?
Yes, they are.
Okay. See, I'm just trying to
make
sure I cross my T's, dot my I's right here. Okay. So they're I feel because their music is, it expanded and everybody, knows about them now. I would expect, or I would, think that when you go to South Korea, you having tattoos or whatever, they would kind of just be okay, this is the norm now. But
Yeah, I thought that too, but then again, it's like I don't know. You just felt like a difference out there. I kind of felt like, and I was telling Raul this like we were like there, and one of my friends like that went with us. So I was telling them like I kind of felt like how my parents felt when they came to this country.
Oh wow.
Where it was kind of like, damn, it's like, is this how they felt when you go to a different country? Like people don't understand you.
Yeah.
And you're wondering like, damn, like how do I get through to them to tell them what I want? Like I just know the basic hi, bye, thank you.
안녕하세요.
Yeah.
That's all I know.
Wait, what did you say?
안녕하세요. 안녕하세요.
Oh, 안녕하세요.
Okay, see?
안녕하세요.
That's hi, right?
That's hi.
Okay. 안녕하세요, right?
Yes.
Okay.
And then thank yous, 감사합니다.
감사합니다.
Yeah.
Look at that. You got the accent down packed and everything.
I tried. I tried. But yeah, so I felt like my parents basically. Like I was like, damn, is this how like they felt when they came to this country? Because like people are looking at me, not understanding me. And like it's just like it was just difficult. And like when we were in the taxis, like some of them like did speak English, but some of them also assumed like because we're saying hi, bye, thank you, like they try to have a whole conversation, and now we're like, no, I'm sorry, I'm so sorry. This is as far as I can go. So, but it was nice overall. Like it was a very beautiful country. I felt like I was only there for like 10 days. So I still personally feel like I didn't get to see enough.
Wow.
But it was nice. It was nice. The jet lag was a lot, but it was good.
How long is the flight there?
So we went to Toronto from here in Newark, and it was I think like an hour and a half. And then from Toronto to South Korea, it was 14 and a half hours. So it was a pretty long flight. Yeah.
That was the longest flight you've ever?
That's the longest flight, I've ever taken. Oof. So it was like rough,
and
the getting there was rough, like going there. Coming back, I think I was so tired from the travel and like everything that we did out there. I just wanted to sleep, so I didn't even feel it coming back. Like I slept the entire flight back.
Wow. So would you ever live there?
I would actually. Like it was just very like easy to get, like just understand things. Like I can see now why my friends are out there. Like they love being there, like, and they would love to keep staying there. And I understand it, like, definitely in terms of, like, I mean, there are certain things that I did miss when I was out there. And, like, I love the food. The food was great. However, I think because being in America, there were certain things where I was like, yeah, okay, there's a little more salt. And I'm just like, oh no, like I'm doing it. No, it's fine. But like my friends felt that way too. Like, oh, I could have used a little more salt, or I could use like
pepper. Is it
healthier?
It
is. So when we went to the street market, there was food that was like, I guess it was like fried food and stuff. A lot of fried food, and like on the street too. Like when you would walk somewhere, like kind of like when you go to New York and you see like the halal carts, it was like that.
Yeah.
So it was, or they would make it in front of you type of thing. So it was a lot of like fried food and stuff, but it didn't necessarily feel like unhealthy. Like one thing that caught my attention was when we went to like a coffee shop. We went to a couple, but I don't think they had a milk alternative, and I'm lactose intolerant. Even though I still eat cheese. But yes, so like I usually drink like almond milk or oat milk, like whatever alternative they have, like I'll take it. And out there, like there were certain places that did it. So I was like, okay, like at least I brought my Tums. Let's see how this goes. But like it was fine. It was fine. I had like, there was a place that we went to at night after like we went like, you know, out in the nightlife and stuff. Like we were relatively hungry. So my friends took us to like a pizza spot. I was so scared.
Korea, wow.
I was so scared that pizza place, or like that pizza in general, was gonna make my stomach hurt, because I'm like, oh shit, there's a lot of cheese. Like, oh my god, like, and it was like really late. Like some of us were kind of tipsy, kind of drunk, like, and I was like, all right, well, I'm gonna eat this, and I ate it. It was a pretty big pizza, and I did not like feel my stomach hurt at all. And I was like, wow, I'm like. So
compared to New York pizza, what you got?
I don't know. They're both like the same to me, honestly. Like with both of them.
You're putting Korean pizza at the pit.
They're both pretty good, honestly. But like, I don't know. Like, they're both pretty good. I would say just because of like healthier, maybe like quote unquote healthier alternative in terms of cheese, I would say Korean.
Listen,
it wasn't,
there's no healthy pizza.
There is no healthy pizza,
like,
but yeah.
If you're eating pizza with like, what is it, the cauliflower pizza and stuff.
Oh my God,
like,
no!
I
can't.
Listen,
do it.
the pizza better, like the grease or the oil better be dripping. Like
it was a greasy pizza, but like I agree, I can't do the cauliflower pizza. No,
ain't doing that right.
I'll be hungry still.
Right, like I love. You go to the gym, I go to I love the gym, but like listen, when pizza's around, like I can't. Don't bring no cauliflower. Yeah, like cauliflower pizza. What is that?
I don't know. But like every time I order it, it just looks burnt to me, and I'm like, they tried. Okay, fine. It's fine.
A for effort. Does effort start with an A or E?
E.
Oh, you see.
Yeah. Okay.
Then where would that quote come from? A for effort.
I have no clue.
E for effort.
It would be E for effort.
Yeah, because when you were in elementary school, you get an E because it's excellent.
I think but I think they would mean like A+, like here's your grade for even making an effort type of thing.
Wow.
Maybe.
America.
I'm just making things up.
Yeah. Same. So did you try McDonald's in Korea?
I did not actually, just because like my friends were literally like, just avoid all the Americanized stuff out there, and I was like, you're right. Same. But I did have Chipotle out there, and it's not called Chipotle. It's actually called cuchara.
Whoa.
Yeah, like spoon in Spanish. So I was it honestly tastes, to me, I liked it better. I genuinely did like it better. The portioning was a little small, but it wasn't as small as like, something that I would genuinely be able to like finish.
Right.
So I thought it was really good. It tasted fresher. It really did taste fresh. Like I loved it.
But it was Chipotle.
It was like when you walk in, you could tell like this looks exactly like Chipotle, like the setup and everything, the words, like the lettering. I'm like, this is basically Chipotle. And when you go in, it's like you order a bowl. Like, can I get a bowl with this?
Yeah.
With this and this? Like, I'm literally at Chipotle.
Oh wow.
So except like they just changed up the wording. I don't know if it was like a copyright or something, but they changed the wording and it says cuchara. And I'm like, okay, but I'm literally at Chipotle, but it's fine. But it was good. It was really good. Our friends took us, and I loved it so much.
Man, I gotta put that on my list. South Korea is definitely. I had a childhood friend growing up. I don't know if you're watching this, Sam Lee. It's been a minute, but hey, if you find this somehow, shout out to you. You taught me how to use chopsticks. More than that, though,
it takes a lot of practice.
It does take a lot of practice.
It takes a lot of practice.
Yeah.
I had learned how to pick up rice with chopsticks, and that takes a lot of effort. But like, if I like eat like that in front of my parents, they're literally gonna be like, "What the hell are you doing? Like, what are you doing?
Right.
Why are you eating like that?" And I'm just like, "Oh, like I don't know, like I can do it."
See, that's the first thing I learned how to pick up with chopsticks, because
it was rice.
Yeah, I'm African. I'm a rice lover. When my boy Sam brought that rice bowl with his family, and it had seaweed, I was like, "Yo, let's get it, bro. I gotta do this." Learned at a young age. I think I was like had to be like 9 years old. Yeah.
No, for me, I think the first thing was ramen. Obviously,
ramen.
Like, it was ramen.
Yeah,
like I had to learn the hard way. Like I was like, I would give up so many times, and I'm like, all right, well, I have to learn.
That's literally Andrea.
Oh my God.
We go out eating sushi, and she's like, nah, I can't do this. She grabs the fork,
stabs it.
Yeah.
I used to do that too with the sushi. I would get so frustrated, but then like I was able to figure it out. I got better just because like it took me a while to pick up like rice. So I'm like, okay, this is a lot better, and it's better to use like I guess like metal chopsticks or like or any chopstick that would, I don't know, not the straw ones. I don't know. I struggle with those, but I noticed with the metal ones or the ones that you can buy at the store. I don't know if they're plastic, but those I can, like, we keep chopsticks here whenever we order.
You use metal
something.
ones or the wood ones?
The I don't even know if they're wood ones. I guess they are wood ones. Yeah, but they're like, I don't know. I don't know how to explain it. And I don't like using the ones that you go to a Chinese store and they give you and they like you break it apart.
Oh yeah, no.
Like those piss me off. I don't know.
Yeah, those are the cheap. That's like the cheap alternative. But like the real ones, actually,
I like those. Yeah, I feel like I have a better grip with those.
Right. Oh man. So how you feeling? You good?
Yeah, I'm good.
Good?
Yeah, I'm loose.
Okay. All right. So, Laura, I got to ask you now
Okay.
about your time in that, I forgot what already. Like, I don't want to call
The
it
psych unit.
Psych unit. Okay. I don't like calling it a mental institution because
Yeah.
that reminds me of like, like those movies with the like super, super crazy people.
Yeah.
Yeah. I don't want to call it that.
No,
so,
I know.
how was your time working there?
So it was different. So my role there was I was a recreation therapist. I was recreation therapy, like we use activities to and leisure to bring people like to go back to doing the things that they want to do, things that make them happy. So I was working there for a year, and it was very different. Like it was just like it would be an in and out unit, so it would be kind of like an in between thing. Mm-hmm. So like anybody from the ER from any other unit would come to our unit.
Okay.
And they would be like, there for a reason. Like either they would have, and my unit was kind of like, it wasn't just like psych, it was also like kind of like a dual diagnosis. So it was like two diagnoses that would be there. So sometimes they would not just have schizophrenia or like bipolar, they would also be there because they had some sort of like addiction or substance abuse. So they would be there with a couple of things. I don't know why, but I don't know if it was like an insurance thing, but I noticed that every single time, like we had somebody that had both things,
right? Or
like not just one diagnosis, unless they really had to be there because that one diagnosis was that bad. Mm-hmm. And then from there, they would be transferred to like a mental institution, like you said, like Carrier, or they would be going to like a group home, like certain places like that,
right?
Like psychiatric residency where they would live there. So they would be places like that. So it would all depend on like the person.
All right. Mm-hmm. So when you were there, what was like every day? Like what did your everyday, job look like?
So it would depend. So like I would get there and we would have like a meeting with the doctor, the nurse or a couple of nurses, the social worker. My boss was like the nursing supervisor and me, like I was the only one that had that role. Yeah. So what I would do is like I would run groups. I would see like, what they would, what they like to do, what helps calm them down, what they enjoy. Like that was mainly my thing. Like I was just creating like the groups and stuff and the activities.
Right. And you would run the groups? Mm-hmm. So it's kind of like I'm thinking movie type thing. So like, correct me though.
No, it's okay.
Was it like kind of like that, like scenery, like you guys are like in a circle, just kind of talking to each other?
It wasn't. That was more so like something a social worker would do, or like a psychologist would do. Like she mainly ran those kinds of like emotion based groups. I mainly did like the arts and crafts, the leisure. I would take them outside. But sometimes some of my groups would get a little deeper, but ours where we were wasn't really like it wasn't really like how do I explain it? It wasn't really like the circle thing. It was like it was like their dining room. Okay. So there would be tables and chairs, and they would just all sit in wherever they want to. It would either be like one chair and a table. So they would be scattered. Right. And it was pretty small. It was like the size of like my dining room right now. Okay. So it was pretty small. And it was very like I would go around and see like what they would like to do, and like I would go one by one to each of their rooms. Like if they're new, then I would talk to the nurse, the social worker, the doctor, and they would tell me, hey, you are safe to see this patient by themselves. Or like, hey, like I don't recommend you see this patient right now or something. Because sometimes I would get there, my shift would start like at 8 or 9 a.m. and I would get there and they would probably just get there from being in the ER all night. Oh, wow. And just because like they had to wait for a bed. Mm-hmm. So I would get there and they would be like sleeping. Yeah. Or like on medication or something, like just not there. Right. So I'm like, okay, well, I can't even have a conversation with you. So I would go in and I would like just knock on their door and be like, hey, like this is who I am. If you want to come to the group this morning, you're welcome to come. If not, it's okay. We can talk later. I just wanted to introduce myself. Yeah. They'd be like, okay, that's fine. Like, or sometimes they'll be like, oh, okay. Like, well, I'm awake now. Like, we can talk. Like, it would just be that.
And when you would first, were they different age groups? Like,
so yeah, the youngest we had was 18. If you were under 18, you weren't allowed to go up. I don't know where they would go, honestly, but like it was like 18, and then we've had like pretty like older people like in the 80s.
Wow. Majority
of those would be like a misdiagnosis where it'd be like it's they actually have dementia or something, or they have Alzheimer's, or they're starting to get that for whatever reason, like gradually, that diagnosis. Or they would be that there could be somebody in their 80s with like schizophrenia, like it's so it's like it would all depend. But sometimes it, depending on where they would go, majority of those people would go to either like a nursing home, an assisted living. It would just all honestly depend.
So this was all to help them get better. And then you guys would kind of...
Yeah, we were like the in-between. So it was kind of like they come from the ER for whatever reason. Then they're in our unit, and then they're there. I think the longest somebody stayed there was like a whole month. And then the shortest stay we've had was like a day or a few days. So it like everybody's different.
Right.
So it just honestly just depends. So like, and also depends on obviously like insurance. So there would be some places where like the social worker would try so hard to like get these people to certain homes or like certain residencies and just institutions, and like the holdup would be like we're waiting for a bed, like there's no beds available. So they could be like, and then that just makes the patient anxious. Like they're just anxious all over again. Like, why am I still here? Why is there no progress? And it's literally like, well, we're waiting for a bed. We can't send you out there. Like you don't have anywhere to go. Wow. Or even sometimes we had like homeless patients, and like the homeless patients, like, so what we would do is like, the nurses would do this in like the mental health assistants, I guess, or aides. What they would do is like when we have a new patient come up from the ER or wherever, we have to literally like take all their belongings and check them, because they could sneak up a knife, they could sneak up scissors, anything sharp. They could sneak up like a vape, something, like all of that had to be taken away. Everything. So we would have to like check everything. And it was like when it came to us checking like homeless patients, it was really hard, because sometimes, you know, like they take everything or bring everything with them. So it would be like a whole garbage bag, and you would just go through and be like, I don't know what's okay now, like what we can keep, what's not okay to keep, because
that's kind of all.
Because that's it, all they have. Yeah. So it's like, and we can't really like, sometimes it would be like a biohazard too. Like there would be certain things where we can't keep because it was like completely soiled or just did not smell good at all to keep. So and like we would feel bad telling them like, hey, we can't keep this, but we can keep this, and they would start like, you know, getting upset, and I'm like, I know, but we're trying, you know, like, and then like when it came to their clothes, sometimes we had some of the nurses wash their clothes if their clothes were like completely soiled for whatever reason or dirty. And like we provided them clothes as well, like gowns and stuff, like hospital gowns, socks. So that's what we would do. And it would be crazy because there were times when I was on that unit where patients had actually snuck up like sharp objects. And I'm like, how did it get through security? How did it get through us? And they would put it in the most random places. Like I think there was one time I was there, and I guess someone had, I don't know if it was a pocket knife or what kind of knife it was, but they snuck it and they put it in like how do I say it? The paper towel holder in the bathroom.
Whoa.
And I'm like, how did it get? And the only person that found it was the housekeeping lady when she was changing the paper towels. And she's like, hey, they found a knife. Like, how did it get up here? Wow. And we were just like, what? Like, how did that get through us? So it was crazy. Like the amount of times like things happened over there. So like, it was wild.
So when you were there, you said you got in like 8 p.m., 9 p.m.
No, I'm sorry, 8 a.m. or 9 or 8 or 9 a.m. Yeah.
Okay, because them graveyard shifts, I would tell you.
Oh no! I didn't work those. Okay. I would leave by like, I don't know. Sometimes it would vary, like 3, 4, 5, or I think the latest I've left is like probably like 5 or 6. But that's only because like we were short staffed. Yeah. I could help the nurses a little with some stuff, or we had so many patients that even the social worker was overwhelmed. Oh wow. To like that she needed help making phone calls and stuff. So I'll be like, okay, well I can do that. Like I don't mind helping you. So I would help with that.
Yeah. So seeing like you said they come in for like probably like a month or so, like, but you also mentioned that people that were addicted to like whatever, like alcoholism, so like would they stay longer because kind of
the detox? Yeah, they would stay longer because of the detox. It would depend though. Some of because it was some of them didn't even want anything. They would just try to go cold turkey, and I'm like, no, like you need something, because it just depends on like what drug or alcohol they use and the duration of how long they've used it.
Right.
Because like it just depends. So like there would be like a medically assisted detox where like the nurses would give them something to be able to detox. I don't really know those medications, but I would just be like, you know, I would be monitoring them in my own groups. Like if they got like the cold sweats, or they say they're dizzy, or they have a headache, or they can't even get out of bed, or they're extremely irritable, like they don't even want to deal with you. So it just depended on the person, honestly.
So how do you feel like that affected you, like mentally?
Seeing all of that?
Yeah.
At first I was kind of like, I don't know, I guess like for anybody, at first it could be like scary. But then like as I started to get to know these people, I'm like, I mean, these are just people. Like you can't really like be upset with them.
Right.
Like, and you start to like, you know, feel bad for them. But then there were those patients where I genuinely like, and it sounds like messed up, that I didn't feel bad for, where I was like, well, because we did have patients that kept coming back.
Oh,
like
right.
kept coming, like, so, and it was really upsetting, where it was like, we like, you know, you said you were going to do this, but yet you're back for like the third, fourth time. So it's like, there were those kind of patients where it was like, you know, we really can't help you. And like, even the nurses and the doctors and everybody, like whenever we would have their meetings, it would be like, it was messed up. We would be like, well, they're back. Like they're here again. Like, what are we going to do? Like this didn't help the first time. What do we do now? Like, and it would be like, it would be really messed up. Cause sometimes like we would be out of like, the social worker and the doctor would be at their wits' end, would be like, well, we sent them to this place, and we gave them this, and that, and like nothing worked. So it's like, what do we do now? So those were like the hard cases.
Right.
And even like, and sometimes those patients were even like rude. Like they would be like, well, what do you do with me now? Like,
I feel like it, like, you know how people say like there are people that are like jailbirds, like they get released and then they do a crime just to go back. Do you feel like there were some patients?
We did have some, I think some of them were mainly like homeless or like just like because chaos was the only thing they knew.
Wow.
Like if you think about it, like that's their comfort. That's what they're comfortable with. Like anything like that's not that is just like abnormal to them, or like not like just like uncomfortable for them, I guess I could say, or like a little out of their comfort zone, where comfort is their chaos, or chaos is their comfort, I mean. Yeah. So like it was just like sad to see that. And then like we had some patients that were also just like had like abusive parents, or had parents that, or families, or wherever they were staying was just abusive and like, or abused them and was just not comfortable, so they would come back on purpose. Right. I remember we had this one patient who like she knew when she was gonna come back, because she would grocery shop for herself. What? And like it was actually really sad. Like we're just like and it was, I remember coming one day where they're like, oh, so and so is back, and she brought this with her because she knew she was coming back, and we're like, what?
Like she planned it.
Like she planned it. Like, and it's messed up. Like, because it's like, you know, you're gonna come back, so it's like, might as well plan for it. I'm like, that's sad. Oh man. But like we did have those cases, and it's like where you get to know them like more on a personal level because they keep coming back. So at that point, it was just kind of like, it was sad.
Oh man. Now, what you went to school for, is this something that you, like the course of something that you wanted to do?
So when I was doing my undergrad and at Kane, I was, rec therapy was my major. Now that I'm in Rutgers now for a doctorate program, and it's occupational therapy now. Yeah. So it's away from recreation therapy, kind of similar, but not really. Like we deal more with like, we can go for any, like in any, discipline, like we can work in any like, environment. Like we can work in the mental health or community, but it's like right now it's kind of unheard of because it's just like now emerging to be able to do that.
Okay.
Or we work in hospitals, nursing homes, like just being able to get people back to the things that they love and the things that they do, just like to be independent again and everything. So it's like we can, but it's just like a little hard right now, especially it's like if you want a stable job. I think working in mental health and like the career path that I'm going to is kind of like a hit or miss. So it's like I'm not leaning away from that on purpose. But because in reality, no matter where I work in healthcare, I'm going to deal with somebody with some mental health thing.
Of course, yeah.
I'm going to like, there's like, even like I'll be an occupational therapist. Therapist is in my like title.
Yeah.
I'm going to hear people's problems no matter what. So
how do you deal with like separating, like especially now, because a couple years now that you're kind of experiencing all of this. So how do you separate that like job and your
you just have to leave
life?
things at the door. Like I learned like working when I was in the mental health unit, like I learned like I had to leave things at the door. Like don't take your problems with you to work. Because then it's like you have to care about the person in front of you. I mean, of course there are certain aspects that you have to be selfish about, like boundaries.
Right.
But like when it comes to like your patient, like that's your client, like they're there for you, like they're there for you to see them, like they're there for you because they rely on you to need help, or you know, like you're part of like whatever they need to be able to get better. So it's like you got to leave things at the door, honestly, and not take it with you. Kind of like when you're with your friends, like you try not to bring things with you.
Right.
I mean, of course, we all have friends and like our significant others that we vent to and like stuff. But there are certain friends that where it's like you can't say things because like they're already going through so much. They shouldn't see you like in this sort of way.
Right.
Because then it's like, you know, then it's going to feel like you're making it about you, but you're not. Like you're not trying to.
Yeah. And then it just adds more.
And it just adds more. And it's like, I know I'm that type of person where it's like, and I need to stop this, where it's like we're having a conversation and then like you're saying something and then I stop you midway just to like say like my experience. And I'm like, I don't mean to say it in a way where it's like, my situation was better than yours. I'm just trying to relate. I'm trying to relate. And it's like, it's a bad habit. And I know a couple of people that do this too, so I'm not the only one.
Right.
But it's a bad habit to have. And that's something that you can't do like at your job, like in healthcare, because then it's just like, okay, why are we talking about you right now? Like the problem is me. Yeah. So it's like it's so you got to learn how to like boundaries.
Did it make you a good listener, a better listener?
It did make me a better listener. I mean, I still do it with my friends because I tend to overshare.
Yeah.
And I overshare with everybody, but when it comes to like, you know, working like in healthcare, like I had to learn how to like, you know, not overshare certain things.
Yeah.
And like just kind of just like, okay, like I'm talking too much, like I have to listen to them. So it just, and then you see it too, like you see it, like if you're working with like a client or somebody, like you're gonna see it in their face where it's just like, okay, like I should stop. I can see that you're getting uncomfortable. So, or like I can see like whatever I said, like X, Y, and Z is not making you happy. So
I feel like it also takes somebody has to really have the heart and like compassion to really want to help, you know, because you get people from all different types of backgrounds, all different types of experiences. So you got to be able to maneuver with that and work with that. So
exactly.
Kudos to you.
Thanks. and also to just be able to just like be transparent and vulnerable, but also know like what not to say and like when to say it, how to say it. Like it's so hard to do that. It's like I feel like sometimes I like have like a little voice in my head that's like telling me, okay, like don't like stop, like stop, or just like, okay, you can go this far, but only you can only go this far. Because
you build relationships.
Yes,
with them, you know?
Yeah, you do, and it's like it's part of like, you know, what I'm gonna be doing in my future. Like whoever I'm seeing or treating, like I'm gonna be building like that relationship with them. But it's like there's only so much that I can share because of like, you know, of course, like the relationship between patient and therapist or patient and whoever, whatever you are, like has to be like there has to be boundaries.
Yeah.
It just has to be.
So I do want to talk to you about therapists.
Okay.
But before that, I want to ask you about like the hospital and nurses and everything. A lot of people believe that like doctors and nurses and this whole like, like medication and stuff, like they're actually trying to like harm you more than help you, especially sometimes I believe this, like some doctors just like, oh yeah, just give him this, give him that, give him this. Yeah. And then it's like that person is so heavily medicated now. Yeah. It's kind of like
no, and like I've seen it too, like in where I worked in the mental health industry. Like it was just kind of like we did encounter some patients that came to us where even our doctors and nurses were like, why are they on this? Like, what is their purpose of being on this for so long?
Yeah.
Like we caught it, like they caught it. They were just like, what? Why are they on this? Like they shouldn't be on.
So with all this doctor and institution talk and therapy talk, there's a podcast that I listened to. I told you earlier. It's medical horror stories. So there was this doctor in the UK back in like the 2000s.
Okay.
In 2001, 2002. And he grew up hating elderly folks. But he always had, like, a part of him always wanted to do something and be something. So he was like, okay, whatever, doctors, And he hated elderly folks because of his grandmother. And he finally got, past the test, whatever, everything, and he became a doctor. And he started working. He was actually a nurse, but he started working in this, like, clinic, small little clinic, and every time he would have an elderly patient, he would like spike up the insulin, like an insulin shot.
I think that's the same nurse that we were talking about.
Really?
No. Oh, actually, maybe not.
Okay.
But it sounds like the same case that happened, like the nurse. I don't know. I think it was the 90s.
In the one in
New Jersey, yeah. Here in New Jersey, like that. That was like long ago.
Maybe got like a correlation.
Maybe. But I don't know about the elderly though. But sorry, continue.
No. So it's all good. He would like spike up the insulin, like medication or whatever, and then he would give it to them, and then they would go into like a shock. Mm-hmm. And it was like a pattern that he did every single time. Mm-hmm. And he would like he would actually like enjoy like causing like pain to them just because of whatever he suffered with in his childhood. Mm-hmm. And there was one patient in particular that he spiked up the insulin or whatever, and the other nurses caught it, and they swarmed into the room. They're like, yo, what's going on, this and that. And he's like, oh, like, I don't know, just the patient just started going into cardiac arrest or whatever. And the patient survived. But then the patient came back like a couple weeks later and had the same nurse.
Oh, my God.
And he was able to have a second chance, and he did it again. And then that night, that patient died.
Oh, my God.
It was so crazy. Like, hearing those stories, like, you can't help but, like, sometimes think, like, yo, what is it, like, sometimes these nurses, I'm not saying, obviously not saying that all of them are like that, but, like, they have so much power in their hands, like, because people come into, clinics and hospitals, and they're, like, vulnerable, you know what I'm saying? Like, they need help. So, like,
and it just scares people to going to the doctor.
Exactly.
Like there are people who just don't want to go to the doctor because they've heard these things, or they just are like, okay, like, I'm gonna wait until I'm like absolutely dying to go into the hospital.
You know how many men don't go to?
Oh my God! Don't get me started on Raul, my boyfriend. Like,
you see, like, there's so
or my dad.
Right.
Yeah.
Right. There's so many men that just like, nah, I don't need to go to a doctor. Like, personally, me, like, sometimes I even hate taking medication. I don't care if it's over the counter.
Oh my God.
Like, I just
really,
like, I'm just like, nah, I'll be all right. I'm just gonna, whatever. If I'm having a cold, then I'll just make some tea.
Oh my God, no. If I'm like having a headache, I'm like, where's my Advil? Like, I just have to. But it's like but it's just because like I know it's gonna help.
Yeah.
So it's like I don't know. I get you. You're like I'm gonna fight it out.
Yeah.
Sometimes I'm like that too, but sometimes I'm like no, I'm gonna be a big baby and take something.
Because like God gave us like natural things that we can use to like
No, and it's true.
Right?
Yeah.
So like, have you ever heard of Dr. Sebi?
Yes, I have. I've seen videos and documentaries.
So what do you think about that?
About his like natural way of
and like him like finding a cure,
and then didn't he like turn up dead or something?
Exactly my point.
Mm-hmm.
Yeah, see what I'm saying?
Yeah.
I don't care. This is out. I don't care. YouTube, you don't scare me. Whoever you government police, you don't scare me.
Oh my God.
Yeah, because these topics are like
No, they're like taboo.
Exactly.
Mm-hmm.
So I don't care.
No, but I've heard of it. I remember reading about it because I was just like curious and stuff. And I think I had a friend in the past who was also interested in this, and we talked about it. And like it's crazy because I do agree that there are things that like people know and then they get killed for it because they know too much, and like it affects like big pharma. It affects like they're like, oh shit, like they found a cure. No, kill them off so people can keep coming to us for our own cures.
Exactly.
So it's like I do agree with that. I agree that there's like a lot of like there should be cures for things by now. Like there are so many things that I'm just like, how do we not have a cure for this by now? Like that's not possible. Like especially with like technology advancing, like are you serious? Like are you sure? Like we can't find a cure, but it's like this disease or this has been along for so many years. Why do we keep needing to have like a vaccine, or why do we keep needing to have like just certain things where I'm just like we don't like why? Like why do we keep needing things?
It's just some things are just really funny to me. Like like just pushing like this crazy, like everybody like get vaccinated. Everybody get vaccinated. Like, oh, can't do this if you can't do this if you like. Yo, chill out, bro.
No, I mean,
like,
I'm vaccinated because like healthcare, like I have to, and it's like I'm gonna do it. But it's like it's like no disrespect to those that don't. Yeah. But it's like when you get a little extreme about it, then I was just like, okay, I don't know, I don't want to be in this lane, but like, and I'm not gonna disrespect it either. But it's like, at first I was like that. Like I didn't want, and my friends know this, like I didn't want to get vaccinated at all. Like I was just like, screw it. But then at some point where I was like, I gotta do it anyway. Like I'm gonna work at the hospital. Like I'm gonna do it anyway. Like I kind of have to. Like right now, like where I work, like we do have patients in isolation and that have like MRSA or like they have COVID. Like they have so many things where I'm just like, okay, I kind of do need the vaccine if I'm gonna be around these people. Right. So it's like it's at the same time, it's like, well, I kind of gotta protect myself as well.
See, I don't knock anybody for taking it. If you took it, if you don't take it, whatever.
Yeah,
like it's
neither.
up to you, you know. But like my thing is like just the commercials and everywhere that you look,
the push, the shoving it down your throat type of thing. No, I agree.
Like that's
it's
my
just
problem.
like, okay, I don't know.
Right, like they're
like we're kind of we're scaring a lot of people here. Like,
and it's funny. It's a fishy thing, and like they're just like, if you actually read between the lines with everything that's going on around us and you really take a look and you're like, okay, there's like some things that are really like interesting.
Like, are you positive?
Right.
Like, are you sure? Like, yeah, it's just like, it just makes you question so many things.
Exactly.
And
and like, for example, this, the submarine thing, right? Like I heard like, like, rest in peace to those, that passed away through that whole thing. But my question is, like, we are in 2023. You lose your phone, you could find it. Your phone is waterproof even, like.
I think they were limited, though, with oxygen when I was reading it. I think they were only, like, I don't know how many
it was
days
only
they
like
had.
a couple hours at the But my thing is like, there's a submarine that's going underwater. You know how far it's going underwater. You don't think you should put a GPS or a tracking device on it just in case anything happens? Like that's my thing. Like you guys can track like, somebody calling someone from like halfway across the world.
Yeah.
But you're telling me like these guys planned this. They planned it for like months, even years.
I didn't know about the story, so I'm just now learning about it.
They planned this thing, and they're all like wealthy people. They're all rich. I think it was like $200,000.
Didn't know what to do with their money, basically.
Yeah. And they wanted to explore. Some of them, like one of them was like went underwater to see the Titanic, the remains of the Titanic, over like 30 times or something like that. So this wasn't his first rodeo. You know what I'm saying? Like, dude came back up over 30 times. So like now he's going with a bunch of other wealthy people, and then like suddenly you guys can't find them.
It's creepy.
It is very funny.
It's pretty eerie.
Right. And talking about all this, like there's the way that they were like, obviously we have to look for them. Everybody's looking, searching for them when this whole thing happened. But like, what about all these other things that are missing in this world? Like the children that are,
I remember putting that on my story today on Instagram.
Right. Yeah, that's something that's going around too.
I saw that,
right?
and I was just like, no, seriously. So I shared it.
Yeah,
there's more important things that we need to look for, but
I feel, don't get me wrong, I don't mean to say that because like I feel bad, like obviously there are people that lost their lives doing this expedition and stuff, and there are families that are grieving, and I hope that like God gives them the strength to deal with what they're dealing with right now. But like in the whole trajectory of the whole thing, it's like, how come y'all didn't put all this energy or promote when there are people that are missing, like people are getting caught up in like human trafficking. Like why aren't we putting our money, the government, put your money and resources in dealing with certain things like that? You know why? Because there are certain billionaires and other people that are involved in that stuff. Like look at where we're headed in this spot. Like this is crazy. This is crazy. Oh man, listen. I don't even know where to go.
Right.
But like it's just in general, like all these things, it's just funny,
No, it's weird.
Yeah.
It's crazy to me.
Listen, all this stuff, Jesus is the only way. That's all I'm gonna say. Jesus, 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 Jesus. Government, it's not you versus me. It's you versus Jesus. Deal with Jesus, government. That's all I'm gonna say.
No, I agree. It's true.
Where have you see? Breath with Brefo leads us to a whirlwind with Brefo. That's where it leads us. Oh boy. So I want to ask you, we're back to therapist and
okay.
No more doctors. So I'm going to talk about doctors.
Okay.
Okay. So do you believe that everybody needs therapists? Like, do we need therapists in general?
I personally believe yes. So you're going to get that answer out of me. Yes, I do.
So for the people that believe, like, okay, they go to a therapist, and let's say this person, because this came up on another podcast that I did. What if the individual that's getting therapy is from the hood, for example?
Okay.
Right. Grew up in the projects, and he gets his therapist, and she has no idea about the life in the projects, and she can't really relate to him. Do you think that would be even beneficial for him?
No, from there, I think you should just find another one. Because there's going to be therapists that literally don't know what to do with you, and it's true. Or don't know how to deal with whatever trauma you're dealing with, because that's not something they can relate to or something they're familiar with. Or they're either one. And it's it just depends on the person, honestly. And everything starts with childhood. Everything, when we're children, we're sponges. We learn everything.
Yeah.
We absorb so much. Sometimes, like I said in the beginning, sometimes when you're small and you're you deal with so much trauma, you think that's normal. You think that's your normal.
Right.
That when you don't deal with trauma, you think something's wrong. So it's it just depends on the person. So it's when you're little and it's that's just what happens.
Yeah.
So
it's like you mentioned a saying earlier, one size fits all, right? So it's not really one size fits all when it comes to therapy and stuff. Dang, then that must be tough for people that actually like really need therapy and having to like.
Yeah, because there are people who like literally have to find different therapists. And the reason why I say like people need therapy, and it's like, you know, maybe people don't need therapy. This is just my opinion, you know? But the reason I say is because like there's so many things that we don't know about ourselves. And I mean, like, it's in terms of, like you said, like, you know, with God and everything, like, yeah, you can get closer with God. And I agree. Like, it helps so much to learn about yourself. However, like, when you just have to master things about yourself that you don't even know. And like there are certain things that we do here on earth that like that we learn, that we see, that we adapt to, that are bad habits. Like, and it's like I'm being hypocritical because I'm speaking of myself right now too. Like there are things that I do that I need to change. I need therapy myself. Like I'm pretty sure we all do.
You know, it's funny. I've thought about it. I was like, you know, because some people think you got to be in a really bad position to go to therapy.
But it's like, and I saw this in another, like, I don't think it was another podcast. I think I just saw it like in some sort of video that I was watching where it was like, you go to a doctor when you break your arm. What's wrong with going to a therapist when your mind's not right or broken, quote unquote? Like, what's wrong with that? So it's like it's the same concept. Like it's just stigmatized so badly. I mean, now with this generation, like mental health is a big thing and people are promoting it and stuff. But it's like it's a good thing that people are coming out more like regarding their mental health. But at the same time, like there are people like that just don't think like therapy is necessary. And it's like, okay, therapy is not necessary, but like aren't there certain things that you have that you would kind of want to talk to about that like you can't talk to anybody else? Obviously you can talk to God and everything. Yeah. But it's like there are things that like, you know, that you don't know about yourself that like you can just explain your whole life story to like a therapist. And they would be like,
I feel like
okay,
it also,
like what?
Some people, it's hard to be vulnerable.
That's another thing. It's hard to be vulnerable. So, I mean, I think with seeing with therapists, it would help you not like be more vulnerable, I guess, like just help you explore more things about yourself. Yeah. Or like they also just guide you. Like they don't just like treat you and they don't treat you to like heal you. Like they just guide you to be like, okay, like why do you think that way? Oh, what do you think of this? Like they just mainly like help you, like guide you, like master things about yourself that you don't know. All right. Like, or like things that you pick up on that you won't pick up on yourself, but somebody else in your life could. And you could be like, wow, I didn't think I was this way. And then like you could get defensive about it. If a person is like, you are this way or you're acting this way, and they can get defensive. And then you're like, why, like, what do you mean I'm getting defensive? This is just how I am. It's like, okay, but why are you the way you are? Like, you don't know that. So it just helps you, I guess, learn things about yourself.
It'll like, you said you go to a doctor if you like your arm is broken. What about if you're like your mind? If you
feel like your mind is broken or like weak, like what's wrong with seeing a therapist? Right. Like it's the same thing. You're going to like, I guess, a professional. Like you're going, like if you need help, you need help. Like so there's something wrong with that.
Right. Do you think though that somebody who, I don't want to put it like everybody's perfect, but somebody who doesn't believe their mind is broken, right? But kind of wants to just go to a therapist to kind of get to, know themselves and
definitely. I agree.
Would that be a negative thing?
It wouldn't be a negative thing. If you want to go to just know things about yourself or like learn or like just to talk to somebody, because like I'm pretty sure we all have like things that we don't say to like our significant others that we hold back because we don't want their reactions, or like just like things like behaviors that we have or habits that we have that we try not to like let come out to the light. But it's like if we just speak to like a complete stranger that would just know and help us, like just like understand, just hear us. Like I have a friend who sees a therapist, and I saw her recently, and she told me that she just listens. Like she was like, I've never talked to somebody that just listens, like that doesn't, because she was seeing a therapist who was just like talking over her, like that she felt like the therapist was talking so much that she's like, I didn't really get to talk. So she had to change it because she was like, I feel like that person didn't even know me. So she changed the therapist. And then she was able to like actually like have the therapist listen
Wow,
to
yeah.
like her whole life story and like what's going on. And it's like that's a nice thing to have, like just somebody to just listen to you. So
You ever thought about going to therapy?
I want to. I do believe I need it. Like I know I get very anxious. Like I have anxiety. I know like I deal with depression as well. Like so it's like I know I have these things, but it's like I haven't gone to therapy myself. So I'm like I'm promoting it, but I don't even go myself, but I want to and I should. And like I probably will call somebody after this. But like
Man, the way you led into that was gold. Oh man.
But it's like no, but I like I said, like I know I should, and I feel like we all should. Like we just have things about ourselves where it's just like, okay, no, like maybe I should see somebody.
Yeah.
So.
Oh, that was hilarious. But honestly, like I've like now that we're on the topic, I've thought about it. Like, you know, like
Were you against it?
not that I was against it, but
Okay.
I was like,
Or like questioning the idea?
yeah, like why do I really like need to talk to somebody about, you know? But I'm like, I know I could deal with my own issue, like not deal with my own, but like, yes, you know, God is there. You like you said, you know, talking to God and you know, God changing your heart, but like just to like talk to somebody and kind of getting their. They don't know you, so like kind of getting their response.
And at
like,
the same
you know,
time,
hey.
like, and I don't mean to like turn this around on you, because I
Yeah,
feel like
yeah,
I am.
yeah.
Do you feel like God gets upset or would get upset or would look down on somebody seeing a therapist?
Absolutely not.
Exactly. So
Yeah.
it's like, what's wrong with it?
Yeah,
like,
yeah.
it's just not like, you know, if he wants you, if he sees it's helping you and he wants you to get help or like in some sort of way and like this is helping you, then like, then what's wrong with it?
Right.
So,
Because if you really think about it too, like talking to like even a pastor, like that's, and like it's literally like counseling. Would you consider counseling therapy?
yeah, there's different kinds. There's like psychotherapy, I think, and like mental health counseling. So I think like I think there's like different types. I don't know the types
Right.
like that, but like I think there's like categories.
Right.
I'm just speaking out loud because
Yeah.
I don't even know. But like I've heard different ones. Like I think like for mental health counseling, I think some of the school counselors are mental health counselors, and then there's like the
right.
psychotherapists. So it's like I don't know if there's like I said, I don't know if there's categories, but like I think that's like that's how it is.
Probably part of like the branch. Right?
Yeah, it's like it's just different like aspects. Like and then there's like specific ones where it's like the marriage ones, like the marriage therapy and
Right.
family. And there's ones where like there's therapists that just speak to children or just be like there's different kinds. So
Yeah.
it's like
Yeah, because if you know pastors are doing counseling, they're listening to people's issues and problems, and you know helping, guiding them. You know, and there are Christian therapists.
There are, and it's like I don't mean, and this term bothers me.
Say it.
It bothers me when people are like, "God is my therapist."
I said that on a podcast.
It bothers, and I don't mean like that's great. That's great. That's
because
like
I get what you're
that's
saying.
great. That's
though.
great. That's amazing. I'm so happy you have a connection with God. Don't get me wrong. No, I love you, big guy. But it's like I'm not trying to like push that down. Like, but it's like, okay, I understand that, you know, you might feel like you're great, like your life is amazing, nothing's wrong, but it's like I know there's something.
Of course,
there's always something where it's just like it just comes creeping in that you're not letting out, that you're not like you're expecting it to God. Don't get me wrong, but it's like sometimes you do feel like you need to speak to somebody.
That's true.
That won't make you feel like you're crazy.
Yeah.
So, and I hate the term crazy, but it's like that won't make you feel like you're crazy.
Cause then at that point too, when I did say that, it was kind of like looking back at it too, it kind of makes you feel, it makes you like look like
very biased in a way.
Yeah, kind of like, you know, forget therapists, but like they're in a position to help people too. Like it's beneficial what they do. And, you know, it's crazy because
it's like they don't heal you. Like I said, like they just guide you.
Right.
They're just literally guides.
Right.
Like they just guide you to like what like steps for your own personality or whatever you're going through. Like that's what they do.
And I do believe everybody has, you know, besides talking to God about it, like people will go to the grave with secrets that they, you know, would want to tell somebody, but don't, you know, can't express it to anyone.
And it's like, don't get me wrong, like you love your significant other, and like I love mine, and I love my family.
Right.
Like they're my best friend. Like certain things, you know. But it's like there are certain things where you feel like if I tell them so much, like just like little things or like how I grew, like more things of how I grew up, what I've experienced, what I've seen. It's just like, are they really gonna look at me the same? And it's like you don't want that estranged relationship anymore.
That's true.
And it's like and I know like that's a big thing with men too. Like men do not open a lot of doors because they want to seem as like this big strong person for their lady, you know, like. And like there are women that do that too. Like they don't want to do that to like, you know, to seem weak in front of their man. So, and it's like it's good to have somebody to just like let everything out and just talk to. And of course you got to go through the whole trial and error sometimes, like, and if you find like a great therapist then and there, like that's amazing. But then there are people that do have to do the trial and error, and it's like it's messed up when they can't, like when they go through the trial and error and they can't find somebody because they don't feel like anybody's helping. And I feel so bad for that because it's just like, damn, like now you're gonna stop trying and feel like it's really not for you when it's like it's like bad luck. So
dang. You just open my mind up because it's true, you know.
And it's like when I was at the hospital, when I was at the hospital, like we did have like people with schizophrenia, people with bipolar, like all those diagnoses, like all those people, they like we've had like there was a pastor specifically, like we had like a Catholic priest or father, and we had a pastor who just didn't like he was Christian, but he was also like a non-denomination. Is that what it's called? Okay, so like he was non-denominational. So he was like he just went there to just talk, literally just talk. Like, and I was like, that's crazy. Like hospitals have like, you know, religious roles, and it's like maybe not too religious, maybe not like religious, but you know what I mean, like spiritual roles, I should say. And like just to like talk, because like we had there, and I've seen patients where they literally feel like God won't accept them because they are the way they are. And it's so sad, or like, and it's like the pastor comes or like the priest comes, whatever, and like just talk to them. Yeah. Just have a conversation. Cause like you said, like pastors and priests and like they're all counselors as well. Yeah. Like, you know, they hear you too. Right. So it's like to see that was really nice because some of them, like I remember seeing like a patient who just genuinely felt like he was like insane. He was like, I'm not going to get accepted to heaven with the way I am or the way that I think. Like I can't help the voices in my head. He was like, and I feel like God's not going to accept me because of the voices in my head. Like it's just so sad. And it's like, it's not your fault. And like, and then they feel punished, or they feel like God doesn't want them because of what's wrong with them. And it's like it's just, or like what's going on with them, and it's like sad. So
and it's like a cry too. It's like he's crying out for like he wants God, and then he's like, yo, but I feel like there's this wall. Dang, I get what you're saying.
And I've also seen like with like LGBTQ like patients that were like going through the same, or like going through like I remember having like a patient who he and this one like blew my mind, where he thought because of like how he was raised and how like he changed, like he changed like his gender, and like he was like, and like his family was very religious, and he was like, I just genuinely did not feel like I was like, you know, who I was. And I like I think they were, I don't know if they were transgender or not, but like, you know, like they changed their pronouns and everything. And then he was like, because his family was so religious, he felt like as if like nobody, like he wasn't going to be accepted to heaven.
This was his own family?
Yeah, no, it was him. Like he would go to like the pastor, the priest, whoever came, and like tell them like, I don't think God's going to accept me because I changed my gender.
And what would the pastor say?
I don't remember what they said, honestly. Like I don't listen to those conversations.
Oh, you're not allowed to?
No, I mean, we choose not to when I was there, like, because it was respectful.
Okay.
But I remember, like, that's what the pastor had, like, told us, like, oh, like, because, like, the nurse would ask, like, you know, what was the conversation about? And he was like, oh, like, he felt this way, but it's like, you know, it's not true. So, like,
And
that's
then-
all they would say, because we couldn't really reveal. The pastors and the priests would only reveal things if it was, like, very, like, dangerous, where, like, I think they're gonna do something to themselves
like
tonight,
harm
like,
themselves or something.
like, we should watch them. Like, that's basically what they would say. But if it was just like a conversation, like, they
Yeah.
wouldn't really reveal much.
Got it.
They would
'Cause of
reveal
that.
it to sometimes to the doctor, like the psych doctor that was there. But, like, I wasn't allowed to hear those conversations.
Gotcha.
So, but it's just sad. So what were you gonna say?
No.
Because I cut you off earlier.
No, you're good. I'm gonna get to it. We're gonna take a break. We'll be right
Okay.
back. All right. So, what really stuck with me with what you said that I know, like, when I go home, it's gonna stick, is that you asked a rhetorical question. You said, "Would God be upset with you if you went to see a therapist?" And the answer is no. God is he's such a good and loving God, and God has placed people in certain roles to be of help and to be of aid. So, yeah, that really stuck with me.
Exactly. So it's like, what's wrong with seeing somebody if, like, you know, they probably gave, like you said, gave that role to them, like,
Yeah.
gave that career path to them,
And
and that's what they are here to do. And
That's
it's like,
right.
what's wrong with that?
Yeah. I'm not gonna lie, I did low key kind of hate on therapists. I'm not gonna lie, I'm gonna say it right. I'll be real. Not hate on them. Hate is a strong word. But I was kind of like, oh, therapist. But I feel like that was like the man in me, and kind of like, yeah, I got Jesus, but, like, I don't want to say like Jesus is everything. He is all, you know what I mean?
Yes,
like,
no,
you
and
know what I'm
I
trying to
completely
say,
agree
right?
with you. And I'm
Yeah.
pretty sure
'Cause
whoever's watching, hearing this would say the same. Like, okay,
Right.
like, I get you.
Yeah, 'cause
I get what you're trying to say.
You made perfect sense with what you said. You know, God would not be upset if you went to see a therapist. So, hey, fellas out there, don't be afraid. You know, don't feel like you gotta be in this, you know, tough macho man persona that you can't go and talk to anybody and be vulnerable.
Same for women. Like, don't feel like you're weak for seeing somebody.
Yeah.
Like, you're not going to be deemed as weak to your kids. You're not going to be deemed as weak to, like, your family members. And it's like, and if they think that way, like, you know, certain family members, if they think that way, that's on them. They either they're against it for whatever reason, or they are, you know, that's them. That's
Right.
them. So it's like, you can't really, but if it's like, if it's helping you and it makes you happy, and or you think that it'll make you happy and help you, then by all means, like, just do it.
I'm just curious to just see, like, yo, tell me what you see. Like, tell me what you see. What's up with me? Like, it will be very, very interesting.
And it's like, there can't like you said, like, you can't necessarily, like, we'll have, like, a diagnosis right there.
Right,
Like,
right, of
okay,
course
so
not,
this
yeah.
is what's wrong with you. Like,
Yeah,
no,
no.
you can't go into it like, damn, I wonder what they're gonna say to me today,
Yeah.
like, or what meds they're gonna give me today.
Yeah.
Like, that's probably not even the case. Like,
Yeah.
you could just be like, okay, like, we're just having a conversation.
Therapists, like you said, they guide, right? Because there's psychiatrists.
Yeah,
They're the ones
psychiatrists.
that prescribe.
Yeah,
Okay.
meds, and stuff.
Got it. With I want to talk a little, since we're on this topic, with, like, depression, right? People that deal with depression, like, I feel like, do you feel like everybody deals with depression?
Honestly, I don't know. I would say yes, but then it's like, I have seen, like, there are, like, people who just are, like, not sad, but at the same time, it's like, I don't know if you're lying to yourself, if you are or you're not. So it's like, I can't say. So it's like, I don't know. I don't know. I know, like, I know for a fact, like, I go through, like, some dark days. COVID was definitely one of the times where I was at my lowest mentally. So it's like, that's where I feel like it came out more during that. And of course, with other things in life, like when you hit your lowest, like a breakup,
Yeah.
or certain things, it's like, that's when.
See, that's so crazy to me. I can't, like, I've gone through, like, hard breakups, right? But, like, I guess the definition of depression is, like, different to, like, different people. Like, like, speaking for myself, I feel like I feel like I was just very sad, but I wouldn't classify it as depression.
Yeah, no, I know, like, for myself, like, well, I don't know, like, if you're sad, like, I don't know how sad you are, you know, or like how, like, what your dark days are to you, look like. Yeah. I know for me, it's like, it's hard for me to get out of bed, do anything. Like, my entire house looks very clustered. My room looks clustered. And the more it gets clustered with whatever I do or just like leave, like, I don't want to deal with it anymore.
It's like, how did you figure out, like, okay, because this is how I'm acting, like, you know, my room's not clean, you know, I want to be in bed all day. Like,
it was the same as you. It was like, why am I sad all the time? Like, why am I sad so much? And it's like, I kind of have to, like, get myself out of it. So it's like, I don't even know. Like, so it's like,
tough.
It's like I feel and when you read into depression, it's like, maybe I'm just self-diagnosing myself, you know, maybe I am, maybe we are. But it's like, when I read into it, I'm like, damn, like, I genuinely feel like that's what I have. And I would have to see a professional to be able to say, to be like, okay, maybe that is what I have. Before for them to say, like, I have what I have. But it's like, I don't know. It's just, it's like, so it's hard to explain, because it's like, why am I so sad? Like, why am I so, like, I don't want to get out of bed. I don't want to deal with anybody. Yeah. Why am I crying so much? Like, it's just, and
I truly believe, like with everything that you're saying, I truly believe there are definitely like spiritual things behind it. Of course, I truly believe that. But I also like to think outside the box often, you know, and just be like, you know, like, wow, like, even to the point of, like, realizing, like, yo, am I, like, feeling depressed right now? You know? Or
yeah,
like,
that's
you know what I mean?
No, I get you.
Like, kind of realizing, like, yo, my room's not clean. I've been missing the gym. You know, I've been, like, you know, and I feel like maybe just for men in general, like, we kind of just, nah, we're not depressed. Like, nah, I'm not depressed. You know, like, I'm just being lazy, or, you know, I'm just not, I don't, you know, like, procrastinating.
That's what I was taking it as too. But then I'm just like, wait, like, and I've been told by, like, a few people that I'm, like, pretty self-aware, and it's like that I've grown to be self-aware, and I'm like, really? Okay, I guess.
Because I noticed it. I realized that too, because you were talking about it. You were like, you know, I picked up on little clues, and, like, you know, like you're saying, the room wasn't clean.
And it took a long time to be able to realize these things, because I would also, like, look back on, like, how I was before, like, or like just look back on how I was before, like before, when I was living with my parents, or, like, you know, like, not out the house or anything. Like, I was looking at all of that, and I was like, damn, like, that was probably depression, or that sounds or looks like a lot like depression. Like, why was I like that? So it's like, I would pick up on certain things. I'm like, damn, is that, like, something that I have? Because, like, I feel that way right now. Like, it's starting to creep back. Like, I would start picking up on, so I would notice it. Yeah. And I would notice things, and I'm just like, I don't know, but, like, it's hard to explain. People probably understand what I mean, but, like, or maybe not, I don't know. But, like, that's literally how it was, like, starting to realize certain things. Yeah. I know what anxiety, like, I know I definitely have anxiety. Cause I've had my panic attacks. I've had my anxiety attacks. My parents witnessed one day, because my parents, and of course, like, this goes a lot with, like, parents, like, they don't believe a lot in, like, mental health things.
And I feel like it's I don't want to say it like this, but, like, foreign parents. Yes. Like,
no. I get what you mean. Like, they're, because this mental health was just not a thing for them growing up. Like, it was just, like, unheard of. Right. So, like, when my parents first experienced my anxiety attack, the first anxiety attack that I had, my dad did not know what to do. Like, he was just very, like it was, I don't even remember why I had the anxiety attack, but it was, like, very bad. I was hyperventilating. Like, I felt like I was going to pass out. Like, it was really, really bad. And, like, my mom was just, like, not knowing what to do. And then, like, I think at a point, my dad noticed, like, I think this is what's going on with you. Like, or, like, in his head, like, didn't say that out loud, but in his head, because then, like, with time, my dad, and he doesn't want to admit it, but, like, we've noticed that, like, he also has anxiety. Like I do the same, like he has anxiety attacks as well. He just doesn't, say it. But like, it's just things that like you pick up on, and it's like I think my dad like noticed that whatever was going on with me, he was like, oh, like that happens to me too. Like, what is it? Like, is that common? Like, why does that happen to you too? I thought it only happens to me, like that kind of thing. So like, and like my dad's, I don't want to say like, hey, you have anxiety, but like I told my dad, I'm like, Dad, I'm pretty sure like this is anxiety because this is what like, this is what we're both experiencing. So it's like he's aware that like of what it is. So it's like, and he's aware of, now him and my mom are aware of like, when I get my anxiety attacks. And like Raul, like my boyfriend, like he notices when I'm like about to get into one too. And like stress is like one of the biggest like things for me. So it's like if I'm extremely stressed, I will definitely have one. Or if I'm like extremely under pressure, I mean, sometimes I work under pressure, but like it depends. I don't know. It just comes out of nowhere. Or even like there have been times where it just genuinely just comes out of nowhere, and I'm like, what was the trigger? I don't know. So like it's weird. It's like hard to explain. But it's like I've learned to pick up things where I'm just like, okay, it's happening. Okay, no, like I have to ground myself and like realize, okay, like no, like I'm not gonna let it get this far this time. Or sometimes I just let it happen, and I'm just like, all right, now it's over.
Wow. So. See, my spiritual senses are kicking in, and I truly believe, like, because I know you believe in like spirits. Your family's church going family, and I truly believe like a lot of things is just spiritual things that we can't comprehend.
No, I agree.
And a lot of things that you were saying was like, I don't know why I had this anxiety attack. I don't know where this came from. And a lot of times it's this spiritual things, and, God is also there to ground us and to give us peace and comfort, because God knows, Jesus knows how we feel. He knows like we'll get depressed. Sometimes we'll feel sad. Like there are Bible people, I don't like to call them characters because it makes it seem like it's a cartoon or a TV show or whatever, right? But like, there are actually like biblical people, like that suffered with anxiety. They suffered with depression. Like, can you imagine how depressed Job was when he lost everything? Like, he was probably feeling depression times 10,
right?
So Jesus understands these things, and that's why he says, come to me, all who are weary and heavy laden, I'll give you rest. So that's the beauty of it too. And obviously God has also given us, people to talk to, friends to talk to, things to, hobbies to do, going to the gym, kind of, taking your mind off of things sometimes, and that's why I believe Jesus, sometimes he was like, okay, I'm gonna go out and pray in the wilderness by myself.
Yeah.
You ever feel anxious or, stressed, and you go out for a walk or something and, just clear your head, and it's
like when, like you said, like when Jesus was here, we don't know what he was feeling as well.
Right. And there's a song by Chandler Moore, and it's called He Understands, right? And it's like everything that we feel, like God became man, in the form of Jesus Christ. Like he went through every single emotion that anybody in this world has felt. So if there's anybody that understands the anxiety and the depression and the pain, like it's Jesus, and he tells us like, hey, listen, like I'm here for you, And one of the ways that I, like, if I'm feeling very stressed and, or overburdened, I go to God. That's my thing, I was talking to Bella, and she was talking about how she suffered with anxiety, and she would like shake, and now her relationship with God, is growing exponentially. It's amazing to see the growth that God is doing in her life. And she talked to me and she was like, man, when I picked up my Bible and I really was like, God, this anxiety that I'm feeling, all this depression, I'm giving it to you because I can't deal with it. It was really bad for her. And she went to God and to just like for God to just deal with her, because most of these things, this like depression, anxiety, we will never understand it.
No, yeah.
You know, it's very deep. It's very, very deeply rooted. So like we won't ever understand it. And it's just, it's so awesome that we're talking about this. Like,
I know. I'm not as close to God as I should be, which I know. And it's like, it's admirable to see it, like, you know, with you and Bella. And it's very admirable. And I'm like, you know, I'm trying. And like, it's just like, I guess from like all the stuff that's like, you know, that I grew up on church wise, like I have to come back into it myself. Yeah. It's just like, I'm trying to.
Of course, so it's of course. Like even me, like, like these past couple months, like, I was like struggling to get, you know, spend time with God. And, you know, God is such a good guy. Like he understands. And not to use that as an excuse or whatever, but like I genuinely enjoy spending time reading my Bible, because it's like it gives me so much peace, right? And it just helps me to know the God that I serve and the God that loves me. And when I wasn't reading my Bible, I can see that life was speaking so much louder, you know, to me. Like all these things that were going on, it's like, no, like I need to go to the Prince of Peace right now. Like there's nowhere else that I can find like this peace. The Bible calls it peace that passes all understanding. So it's like you can't even comprehend it. Like, yo, why am I feeling so joyful? Why am I feeling so much peace? Like, where'd this come from? And, you know, there's a big difference between happiness and joy. Like, joy is from within. It's deep from within. And it's, you know, it's God that gives us the joy. And happiness is temporary, you know. If we're feeling sad, okay, you're going to go out and play soccer. That makes you happy. You're going to go out and shop. That makes you happy, right? But the mall's closed.
Yeah. You
know, the stores are going to close, right? The soccer game is going to end. And that happiness is temporary. It's going to fade away, and then it'll all come crumbling down. But when you have that joy, the joy of the Lord, the Bible calls it, then, you know, that's like a never-ending flow, right? So, so good. I can go on and on about Jesus. And so I do want to try this awesome game out.
Okay.
This is a questionnaire thing here. And you can ask me a question too. This is the
get deep part.
Yes.
Get more deeper than we're getting.
Yes. So I can't ever do this. I can't do it like how some people do it, you know, like the card thing.
The shuffling part? Yeah. I can't do it either. I
attempted.
It would have all flown if I would have tried. So I'm going to let you do it.
E for effort. See, This is the best I could do right here. And look how slow it is. I don't know how people do this. All right. That's good enough. Pick a card, any card.
Oh, no. Okay. It says, if every human came with a warning label, what would yours say?
Oh.
That's a good one. I don't know.
Wow. That's interesting.
Can get temperamental. I don't know. Be careful of be wary of temper or something. I don't know.
Do you feel like you get hot, you explode? Quick?
No, I don't explode like that. I don't know. I guess it depends on the situation, right. Or I don't know. I guess I don't know, but I know I have a temper. Like I know I have I just sustain it. Certain things, let it out. But
how do you deal? Like, for example, for me, like if I feel myself getting hot, like I will just shut down. Like I'll just be quiet.
So I could either shut down or like go for a walk. I try so hard not to lash it out on anybody because I'm like, I know I've had that problem in the past to lash it out when I'm angry, and I'm like, why am I so angry?
Right.
Now I just kind of I started going to the gym again, so go to the gym again. Like, what was it? Today, I literally was on the phone with Raul, and I was like, babe, I'm going to go to the gym. Like, I'm too anxious. I'm too irritable. Like, I'm going to go to the gym and work this out. And he was like, you go, babe. And I'm like, okay. And I just went and I was there and I was like texting him because like, I hate when people hog the gym machines and they're on their phone. So I was literally texting him and I was like, there's this guy on the machine and he needs to get out because he's not doing anything. And I'm getting so upset. And I just sat there staring at him, like waiting for him to just like, read the room, like just get up. And eventually he did. I was like, all right, cool. Like, but like that's just how I get. I don't know.
I love how you texted him like, I can't believe this guy.
No, that was literally me. I'm like, I can't believe this. Like, oh my god. Like, I'm just like, I sound like an old lady.
To text him though is just the most funniest thing. Like mid workout, yo, you would not believe this guy has been here for. He's like, this guy, 25 minutes. I'm like, what are you? Oh, she's at the gym. Like he's probably like, yo, what? That's hilarious.
Mm-hmm. What about you? What would your warning label be?
Warning label. First they're sour, then they're sweet. First he's sour, then he's sweet.
I could see that.
Like my friend, one of my best friends, Jason. I'm not even call him my best friend, my brother. He's one of my brothers. So he the first time we met, I actually looked at him like it was in middle school, walking, and I was like, who the heck are you? Like that's what I said to him. I was like, who the heck are you? What are you looking at? And I was just so mean to him. I don't know why. I was like,
you mean?
Yeah, right.
I have never.
But I know it's hard. It's hard to imagine. But like, yo, I was rough. I was rough. So he was like, I was like super mean to him, and I just came like with this like alpha male, like, yo, like, who are you? Like grilling him down and everything. Mm-hmm. And now look at us, pals. So warning label. First he's sour, then he's sweet. All right.
Alrighty. I'm gonna.
Yeah.
You're gonna pick a card now?
Yeah, I'll pick one.
Okay. Well, I can't shuffle it well, so we're gonna do this.
Yeah. Everybody goes for like the middle. You know what? I'm going over here.
Oh, okay.
I said everybody, like everybody's here. Here we go. What flaws would you be okay with in a romantic partner? Andreita. Here we go.
Oh no.
Here we go. Andreita, here we go. What flaws would you be okay with in a romantic partner? You know, oddly enough, I'm okay with a little attitude. I'm okay. You know, my lady is a Latina, Colombiana, so, you know, a little rough. So I'm okay with...
Your voice is cracking. I'm okay.
All right. I'm all right with
What's her attitude?
Yeah, because you know what? I like... Yeah, you know, there's really no explanation to this. I'm okay with it, you know, like, because it's not like everybody has a, you know, attitude. Everybody has a little, you know, pizzazz to them, right? I even have that. If it wasn't for her, I wouldn't know that I have a smart mouth. I thought I was. Apparently, I'm very I'm slick with the words that I say, so I accept it, you know. So that's my little attitude, and yeah, sometimes she could be a little feisty, but you know, all in that's just a minor flaw. I love her how she is. Okay. I love her how she is.
I'm trying to think with Raul. I'm trying to think. You said a flaw.
Yeah.
What flaw you are okay with? What flaws would you be okay with? Okay, so let's see. So he does get like. So he gets distracted very easily, like very easily. And at first it was just like, I was just not for it. I'm just like, I'm not for this like random distraction. Like, I mean in terms of like, he'll do something and then be like sick of it or forget where it is and just leave. And I'm just like, you were in the middle of this. And sometimes I'm just like, it bothers me, but then sometimes it just makes me laugh. So I'm just like, what occurred to you in the moment of time for you to be like, screw this and then just do something else? Like, it just blows my mind. So sometimes I literally sit there and I'm like, what happened? I just start laughing. Or like, or like he's just extremely random. Like, I think like he'll literally start saying like random sayings or something that he heard. And sometimes like I would get very upset. Like, you gotta be serious in this situation. Like, stop being like, it would bother me because I'm just like, he's not being serious. Like, we're having a serious conversation.
Yeah, and that's how Dre with me. Like, literally.
And then he'll just like throw something like, I don't know, like a line from SpongeBob or like Family Guy. And I'm just like, I just stare at him like so like annoyed. Like, why?
Like where'd that come from?
Where did this come from? He'll be like, I don't know. And I'm just like, okay. And then sometimes it would bother me and sometimes it would just make me laugh. So those are flaws that I'm okay with because he's just like, he's a giant kid at heart. And I'm like, I can't be mad at you.
Yeah. Oh, man. Imagine he's like out the door. He's like,
he probably is at the door right now.
Listening to.
Like, I'm going to remember that.
Right. But we love them. We love them.
Yes.
We love them.
I'm going to pull another card.
Let's do it.
Just put a random one. What's one weird belief you used to have when you were a kid? For me, it was the stork.
I never heard of that.
The one with the, I think it's a stork. The bird that kind of looks like a pelican, but not a pelican, that would carry children.
Oh, yeah.
It would carry children to your doorstep. So that's what I believed.
You thought that was
I thought because I saw like, what was it? I think the movie Dumbo.
Yeah.
And then in the Grinch, it also happened in the Grinch.
Don't they carry it in like a bag though? Not a bag, but like
sometimes it was in some movies it was a basket, and some it was just like a blanket, like swaddled.
Yeah.
And then like I believed it. I really believed it for like a long time. I'm just like, wow, this is how kids. This is like, I'm like, so I was just dropped off at your doorstep. Cool. Like it's pretty much what I thought was being brought up.
Oh man.
And then it was
One weird belief you used to believe when you were a kid. Honestly, I thought wrestling was real. I thought WWE was real.
I think a lot of people did.
Yeah, I
believed it did. It was too.
Right.
And then at some point I started hearing like, it's fake.
Yeah.
And I'm like, where are these coming? Like, where is the fake coming from? Right. And I'm like, oh, it's rehearsed. Okay. Like, I didn't know either.
I'll never forget watching this one episode. It was Brock Lesnar with this one kid that was like on a wheelchair, and he only had like one leg, but he wrestled, and like there was a locker room scene or like a garage scene, like they were outside and Brock Lesnar had him like on a wheelchair, and like I think he was tied up or something, and there was a flight of stairs, and he was like, and he just threw him like on the wheelchair all the way down, and he just fell like, and I was like, he's dead. Like I was watching, I was like, he's dead. He's dead. Like I can't believe they showed this on TV. Like he's dead. He killed him. And since like I will never forget, I was like, Brock Lesnar's such an evil person. Like I can't believe you. Yeah.
Oh my God.
Yeah, me and WWE, we were a fun team. Every Thursday and Friday and Velocity. If you were a deep WWE fan, you know what I'm talking about. Sunday Night Heat, all that.
Oh my God.
You want to go one more?
Sure.
All right, let's do it.
Okay. I'll go. I always go for the middle.
Yeah.
What's one sign that you would probably stay friends with someone for life? Ooh, that's a good one. A sign that would probably mean.
I got one.
For them to, I have a couple, but it's hard to pick like one. Like I guess like I don't know, like the sense of humor or like the ability to be real.
Yeah.
Like that's two, but it's like hard to pick one. So it's like the ability to just be real.
That's good.
So and like vulnerable.
That's good. For me, it would be loyalty. Definitely loyalty. Like you could be loyal as a friend. Like nah, we locked in.
What's an example?
Man, okay. I got a good one, but it's gonna take some time, so we're gonna be back. You heard the monotone in that voice?
Yes, I did.
So loyalty, there was my best friend, my brother Randall. I got caught up in some criminal activity, and his loyalty throughout the whole thing was just like, it just blew my mind. You know, it was like he kind of gave everything that he had to make sure that I wasn't going to end up in a bad situation with whatever happened. I'm not going to get into it, but with what happened, he made sure that, like, yo, like, I'm going to be there for you. And, like, thank God it didn't, like, lead up to anything crazier. Mm-hmm. But I knew that it was going to go left. But, you know, his hand in the situation helped it so much that, you know, thank God, it didn't end up in, jail time or whatever or anything like that. So when I saw that, and there are many, many things that he's done, and, like, I don't want to say proven his loyalty, but just showed how loyal he is. Like, he's my brother for life. Randall's like here, like, I just thank God for him in my life. He is more than a friend to me. He's like a blood brother through and through. Yeah. So that was a good question.
I think for my friends, it's like, for us, we kind of like call out on our shit. Like, I think we've like within my friend group, like, I think we've all had interventions with each other. Yeah. Or it's like, okay, like, and it's just like not even like planned interventions. Like, right. It just happens where it's just like, oh shit, like someone's messing up. Yeah. And then we got to talk about it. Like, that's literally how it is. So I guess for us to just like catch us on our own shit, like, that's basically what we do to each other. And
that's so good, because that's how you know you got real friends that genuinely care.
Yeah, and it's like we're not afraid to like be honest or be like, "What the hell are you doing?" Like, and it's like, because no one else is gonna like do that. I mean, other than like family, but then there are people who are just gonna like make you like just like see you, like let you act a fool, basically. But it's like we don't do that, and it's like we don't let each other act like fools. Yeah. Like, we're just like, no, like, what are you doing? Like, why are you doing this?
See, shout out to our people. We love y'all. So, man, we talked about so much, Laura, and thank you for just, opening up and, for this to even happen. But before we go, like I always do on every episode, I have to leave you with whatever is on your heart, anything that you want to say to anybody who might be listening. I know we talked about depression, we talked about anxiety, anything that's on your heart, anything you want to leave with.
So I guess I would say, like, if you feel like you would benefit from seeing somebody, then definitely do it. Like, don't let whatever your family says or like your so-called friends, if they don't think like it's appropriate for you, like don't let it like overshadow that idea. Like, just like, if you feel like it's going to benefit you, then do it. Like, get help, talk to somebody. I mean, obviously talk to your friends and your family and whoever, but like, don't, if you still feel like that's not enough, then like, like go find somebody, like I said, and then ask for help. Like I said, just keep asking for help. See somebody, go to church. I know I have to go to church and like, get closer with God and everything. So I'm speaking for myself as well. So yeah, that's what I could say.
There you have it, y'all. Till next time. Peace. Thank you so much for listening to the podcast. If you enjoyed that episode, make sure you subscribe for future episodes and feel free to rate and review. For more information and ways to support, check out our website at abreathwithbrefo.com.